welcome back to another Q&A session. Today I am joined by two very special guests. I have a lovely senior physiotherapist, Lauren, and her gorgeous chocolate lab, Molly. And today we're going to be discussing women's health. So, Lauren, as a physiotherapist with special interest in women's health, what drew you to this area?
Good question, Sophie. And Molly will just be eating from my hand as we talk. So the original reason I got into women's health is I have a real interest for the pelvic region. So I'm a little bit of an anatomy nerd, and I do actually like that area. But I actually really enjoy working with women. I find that they're really appreciative, and particularly working with pregnant and postnatal women is really rewarding. So that's one of the reasons I got into the area.
Lovely. Now I know there are a number of conditions in which you treat. It's amazing. Would you be able to briefly explain some of them?
Yeah. So a lot of people don't know that physios who have special sort of postgraduate qualifications like myself in women's and pelvic health, that we treat quite a lot of conditions. So for example, with regards to the bladder, we treat issues of leakage, urinary leakage. So for example, if you leak when you cough or sneeze or run or skip, we look after that. And then of course we also treat issues where maybe you're having difficulty where you're feeling really like you have to rush to go to the toilet to do a wee. And then, or maybe you're leaking on the way to the toilet, so we also treat that as well. That's called urgency and urgent continence. We also treat conditions with the bowels. So for example, if you're having difficulty holding your wind, or maybe you are leaking a little bit of stool, we treat that too. And then of course, we treat a lot of pregnancy and postnatal conditions. So things like pelvic pain, lower back pain and neck pain that might come from being pregnant or postnatal. My dog's just eating all my food here. We also treat things like prolapse as well, which is one of the common things that I treat, prolapse. And then also things like abdominal separation that occurs possibly during the pregnancy and postnatal, so we treat that as well and rehabilitate that. We also treat pain conditions. I've already talked about some about pelvic pain and lower back pain, but we also actually treat things like sexual pain. So pain in that pelvic region that may be relevant with the pelvic floor. So we treat that as well. And then also conditions of the breast, which comes under more that postnatal conditions, where maybe a woman has a blocked duct or she's got mastitis, and we can treat that too.
All right, okay. So Lauren, what does an initial women's health assessment involve?
An initial assessment, there's two different types of initial assessments. So if it's more relevant for something like continence or the pelvic floor or a bladder or bowel issue, then we normally need an hour for that because it's more detailed. We actually do ask a lot of questions just to get a really thorough history, and then it usually does involve a vaginal exam if the woman consents to that, because that's what we are trained in to do. We are trained to do that with our postgraduate qualifications, and that gives us a much more detailed history of what's going on and be able to give better treatment really. If it's a problem more with sort of low back pain, or it's a breast issue, or it's some pelvic pain, that usually takes about 40 minutes, okay? She's gnawing at my hand. That usually takes about 40 minutes. So essentially what we're doing there is still doing a thorough assessment, but it just doesn't require as much time.
Okay. Now I do have another question, because as a receptionist, I do get asked about this a lot. How does a woman know if she needs to be booked for physiotherapy or women's health?
Okay, yeah. So essentially what they can do is, if you feel comfortable, you can actually let reception know a little bit about your concern. If you do actually feel comfortable with that, then usually reception know whether or not what they need to book in for. If you do not feel comfortable about that, then you can actually request to speak to me, and I'm happy to actually speak to you and give you advice on what I think is most appropriate for you. But the more information you can give is it's helpful, because then we actually know what we need to book in for, and the staff here obviously respect people's privacy. We all do, so yeah.
Lovely. Well, thank you for answering some of my questions regarding women's health. So obviously Lauren is our physiotherapist with special interest in women's health. So if you need to see something about women's health, or even just a physiotherapy,
or you want to meet Molly,
who is probably the friendliest dog, then call up and book an appointment. And we'll see you next week. Bye.
Bye.